Hello, my name is Susan O'Kelly with Avanti Health First, and welcome to Medicare Drug Plan Changes for 2025. Let's get started. So, the Inflation Reduction Act of 2022 was passed that summer and began to be implemented in 2023. Now, the law brought many changes to Medicare Part D and affects all types of Medicare, including Part D individual plans, employer group plans, standalone drug plans, and of course Medicare Advantage plans. So I don't want to scare you, but let me prepare you for a 2025 annual open enrollment because it's coming. I want you to have a strategy in place as you begin to look at what plans might look like for 2025. And I think it's important that you work with a licensed and trained agent, somebody that understands these prescription drug plan changes and knows how to work through and help you with strategies to navigate these complexities. They're coming. All right, let's look backwards in time though. There has been a cost shift. And so we saw in 2023 some great things happening. Part D vaccines were expanded, and the insulin savings program was great, capping insulin at $35 per month. Current year, we have $0 cost share in the catastrophic phase. And for 2025, there's 4 key elements that are really great. We have a much lower out-of-pocket maximum. We've gotten rid of the donut hole. Medicare costs have gone down by 20%. Now that's a key element of why we're here today, because we're going to look at how that works together and what we're going to see as consumers changing for us in 2025. And then my favorite little piece to this is the Medicare prescription payment plan option, the M3P. What it does is it spreads monthly prescription costs evenly across the year. So the Kaiser Family Foundation has put together a really great slide. I know it seems busy at first, but let me direct your attention to the catastrophic coverage area. Notice the difference between 2024 and 2025. The Part D drug plan is going to be paying more. That is part of what's happening with drug plan changes that we are going to see as consumers. But what's interesting is that drug manufacturers have more skin in the game, especially in the catastrophic coverage phase. They don't have that in the current area for 2024 in the catastrophic coverage area. And what those two pieces do, the drug plan and the drug manufacturer costs increasing, it's lowering the load on Medicare. That's great news, but we need to understand a few things like true out-of-pocket costs. What is it and how does it work for my plan? Well, not too many changes there. I just want to remind you that payments that don't count towards your out-of-pocket cost include those things such as maybe you're getting prescriptions from a Canadian pharmacy. Maybe you have drugs that are not part of your formulary or are specifically excluded. Of course, those don't count costs towards your troop. And as usual, we have that currently and in years past, over-the-counter drugs, supplements, vitamins, and whatnot. They don't count towards that troop. So as you begin to strategize, bear that in mind. There hasn't been a change, but just don't forget it. So what's our standard? Well, we have a $590 deductible coming for 2025. The initial coverage phase coinsurance that we have to pay is still the same. It's 25%, but we do have that lowered $2,000 maximum out of pocket. And no donut hole. We go right to the catastrophic phase, and just like our current year, we don't have any co-sharing for drugs in that catastrophic phase. Well, what's happening? Let's take a look at the considerations we need to think about and what are the impacts. So considerations, both Medicare Advantage plans and PDP plans are going to be increasing in costs without a doubt. Now, Medicare Advantage plans have a little bit more flexibility because they have those extra fun benefits like dental benefits, vision benefits, silver sneakers, and things like that. So what's going to happen is the Medicare Advantage plans are probably going to reduce those benefits. And not only that, Medicare Advantage plans that have a $0 premium for their prescription drug that's embedded within, that's probably going to go away. Now, on the impact side of things, more utilization across the board, and utilization management we'll get into in just a moment. Now, Medicare Advantage plans, I just told you we're going to see a reduction in benefits and things of that nature. The Medicare Advantage plans are very popular, so what we're predicting is that those changes, they're going to happen, but they're going to be as minimal as possible. Unfortunately, the PDP plans, the prescription drug plans, don't have room for flexibility. They don't have any additional benefits that they can carve out. So of course we're going to see increase in premiums. Formularies, your drug options within a plan are going to become more limited. And then plan choices in general, how many carriers are going to be out there for us? It's going to change a lot. Let's take a look at these 4 key areas: higher premiums, plan choices, formularies, and drug utilization. All right, higher premiums. I've said it at least 3 times already. If you have a standalone PDP, expect that premium to increase. Now, we're not going to know what the plan is going to, any of these plans are going to be looking like until October 1st. But it's still not too late for you to start thinking about what's coming and what you might be doing. We just don't know the answers. The other thing that I'm hearing on the grapevine is this premium cap at 6%. Now, that's false. What's happening behind the scenes is that Medicare negotiates with the pharmacy benefit managers, the PBMs, and the drug plans. And there are complex math calculations and formulas that are part and parcel to this negotiation process. And it's behind the scenes, and it has very little to do with us on the consumer side of the fence, as it were. What I want you to focus on is at the bottom of this page, pricing, how it's going to impact you. Know that your deductible is increasing to $590, and know that your formulary is going to be shrinking. Okay, fewer plan choices. So what does that mean? We have carriers that maybe have 5 to 7 different plan choices. That's probably going to shrink down. I can see 1 to 2 plan choices with any individual standalone drug plan. In addition to that, within the plans, there are going to be restrictions. Also, we have $0 premium plans right now, and we are predicting that those are going to go away, even the low-cost plans. The average prescription drug cost plan is definitely going to increase. Like I said before, we don't know what those numbers are going to be. We will know soon enough, and I can't stress it enough. Now is the time to start planning. That said, I don't want you to have to make the choice of putting food on the table or buying your drug, but work with an agent and think about options, because if you have that one high-cost drug and you're not on a drug plan and decide, I need to jump into something, you're going to be facing enrollment penalties, and I just don't want to see that happen. Let us help you with that. Formularies. The formulary means what are the drugs on my plan, and you just got to anticipate that these formularies are going to shrink down. Now, every formulary has to have at least 2 drugs from every class on your plan. And on this slide, I've identified the 6 protected classes. And what that means is that there's drug coverage for these protected classes for sure. But you're going to need to look at alternatives. Can you be flexible and work with a different drug? Work with your physician and get on a different prescription. Look for other alternatives, alternative drugs, alternative options, manufacturers' discount programs, grants, pharmaceutical programs. There are many things out there, and don't forget, reputable Canadian pharmacies are an option. Now, some of these things I've just itemized, don't forget, they might not apply towards your troop. So bear that in mind. All right, utilization. What do I mean by that? Well, utilization management means reviewing the prescriptions that you're on, looking at prior authorizations. That's not uncommon if you have a drug that needs a prior authorization, but we're going to see more of those. And step therapy. So let's say that you're on a tier 3 drug, a pretty expensive drug. What's going to happen is that those drugs are going to be likely excluded and or extremely expensive, and the plan is going to insist that you try, maybe we'll call it drug A. It's a lower cost, and you fail, and so then you go to drug B and you try that drug and you fail. Then you get to go back to that T3 drug you were on. So expect more of that. It's a process. It's that flexibility. So let's all be prepared. Quantity limits. Let's say you're on a prescription that has 40 pills per month, and your formulary now limits that fill to 30 pills per month. You will circle back and go through the prior authorization process and get that quantity limit changed so that you can get the appropriate prescription. Here's my favorite. I love this. Part of it is a mouthful, but I call it the M3P program. It's the smoothing program. So I want to state again that this is not going to reduce your drug cost. It's not going to make that cost any less out of pocket, but it's going to spread your costs evenly over the year. So instead of having one really expensive payment, it's just easier to deal with across the year. All plans have to offer this. You don't opt into this at the pharmacy counter, and you can't call me. I wish I could help you. You have to call your insurance company. Now, what probably will happen is if you're in the regimen of having your prescriptions pre-scheduled in advance, what will happen is you'll probably get a reach out from either your pharmacy or from your drug plan, and they'll say, hey, it looks like you might qualify for this program. You need to opt in or consider opting in. Once you're opted in, your insurance plan will bill you monthly. Let's dig a little bit deeper. How do you enroll? Well, what is the eligibility? It's optional and it's voluntary. You don't have to have a minimum drug cost, but I suggest here that maybe consider if you have one $600 premium, a pretty expensive, not premium, cost for a drug, that might be a trigger for you to think that you might want to consider opting in. Again, it doesn't lower the cost of your drugs, it just spreads it out. Now I've got an example here that's based on that $2,000 maximum threshold. And if you have a $2,000 drug, if you were to spread that cost out equally, it would be $167 per month. Please remember, this is an example only, just to get your head wrapped around how this program works. Each of us are unique individuals and have unique prescriptions that require us to take a deeper dive. Again, reach out to an agent that understands these strategies. All right, in case you're interested and want to do some research on your own, go right to CMS, the Center for Medicare Services. This QR code will just go right there, and there's a lot of information out there, so take a look at that. But before we move on, I don't want to forget about my people that are still working. If you are still on an employer plan, you definitely need to do a plan review. This could affect the plan you're on, and you want to be sure that your plan is considered creditable coverage. Be sure to make that happen. And the reason why is because, remember, that threshold is coming from $8,000 down to $2,000. Just review your coverage, and now is the time. We got to get started sooner rather than later. October 15th is when you can make changes to your plan through December 7th. We can start talking to you about plans as early as October 1st. Click on this link. If you're part of the webinar, grab it and book an appointment on my calendar right now. My calendar is filling up. I just want to also remind you, for those of you that are on a Medicare supplemental plan, let's take a look at what's going on. We want to compare your current plan and maybe consider a high deductible plan or maybe a hybrid plan. Should we, if you're on a plan G, should we look at a plan N and compare what that might look like? Maybe even explore shifting from Medigap to a Medicare Advantage. So now's the time. Let's do this sooner rather than later. Click on that calendar link. So as I wrap up, I want to say, the Inflation Reduction Act has had a really meaningful financial impact on many with on Medicare. So be sure to work with an agent so that you don't get lost in confused and overwhelmed and do nothing. Doing nothing is not a choice. My mission is to demystify insurance and empower you to make choices, because insurance is complex. I'm passionate about this, and we don't charge a fee for this service. I love what I do. If you have a family member, a friend, or a neighbor that needs guidance, have them give us a call. I've put my number up on the screen here for you, 303-278-2278. If you didn't catch any of the other prior links or QR codes that popped up, here it is again. Get on my calendar. Let's talk and help you figure out what might work best for you in 2025. Let's get started. Thank you so much for your time.